Hello there, everyone. Welcome to Ask Dr. Bob. This is where you all get to ask me questions about diabetes. And so my name is Bob Gabbay. I'm the Chief Scientific and Medical Officer for the American Diabetes Association. And it's my pleasure to do the latest episode here for the month of October. And this month we are, as those of you that have been watching us for a while, we pick a theme each time, and this time we're going to talk about neuropathy, diabetic neuropathy, and chronic pain and other issues that can be associated with neuropathy. You were all kind enough to send in a number of questions, and for those that may not have had a chance to do that, you can throw some into the chat while we go along, and I will do my best to answer your questions as you ask Dr. Bob. So, without further ado, let's get started. And the first question is a great one. What is diabetic neuropathy? Well, um, I'll start by saying neuropathy. Uh, Neuro is nerve, and opathy is disease. So it's disease of the nerve that happens in people with diabetes. So that's the broad thing. What's diabetic neuropathy? But more specifically, there are sort of three flavors. So the nervous system has, I could say, simplify into three sort of branches or three types of nerves, if you allow me to say that. One is sensory, the things we feel. One is motor, the things that move us, moving my arm like this, those are motor nerves that do that. And the third kind of nerve is autonomic, and those are the things that do automatic things. You could think of them, things that we don't even think about. Um, that could be maintaining the heart rate at a certain rate or helping with digestion. Those are things that we don't think about. They're automatic, and that's the autonomic nervous system. Okay, so why am I telling you all this and the three types of nerves? Because diabetic neuropathy can affect each of those nerve systems and in different ways. So let me explain. The first one, sensory, the nerves that you feel. That's a very common form of neuropathy, and the way it's most commonly experienced is tingling or burning of the hands and feet. That's a really common symptom for people with diabetes, and those are the nerves, that the sensation nerves that are affected by diabetes. So that's sensory. Then there's motor. What kind of motor neurons, or which would be the technical term, or what kind of movements are effective? And one that people with diabetes get more commonly than others is something called Bell's palsy. You may have heard of Bell's palsy. Bell's palsy is sort of a facial droop. You may have seen people that have like one side of their mouth drooping down. That can be as a result of nerve damage, and that nerve damage can be caused by diabetes. Okay, so I did sensory nerve, and that's the tingling in the hands and feet. I did motor nerves. That's the muscles of the face, Bell's palsy as an example. And then the autonomic one, automatic things, in a sense. An example of that is something called gastroparesis. So, gastro meaning the stomach, the gastrointestinal tract. And paresis means paralysis or weakness. So, what happens is the stomach does not empty at a normal rate. Gastroparesis. The stomach is half frozen. It doesn't move the food along as quickly as possible. And that can be a big problem for people with diabetes. Diabetes is a big cause for gastroparesis, and it can lead to a lot of symptoms like feeling full because food is not exiting the stomach, can lead to nausea because it's sort of almost like backing up. So a whole host of problems, and when it's even worse, even to the point of vomiting. So I know that was a long answer, but that sets the stage for diabetic neuropathy, which is our theme for today. So let me move to the next question. Does everyone who has diabetes develop neuropathy? Well, it's a great question. I would say that depending how long someone has diabetes, most people will develop some neuropathy. And that some neuropathy may be so subtle that they don't even notice it. But if they were tested in special ways, you could detect there's some neuropathy. So, short answer might be yeah, most people over time are likely to get neuropathy. Not everybody's going to have symptoms or even know that they have it. And then the question that was asked, which I think is really important, is there any way to avoid this complication of diabetes? And good news, yes, there is. There are a lot of ways. And really the ways to avoid neuropathy are sort of the same ways, if you remember when we talked about kidney disease or eye disease. It's the same kinds of things. And what do I mean by that? We know that people that are able to manage their blood sugars and keep their blood glucose in range, um, they're less likely to have nerve damage. And so that's a really important thing you can do. And we'll talk in a little bit about ways in which you can help manage your diabetes and keep your blood glucose levels in the right range. Okay. The next question is this complication, neuropathy, more common in type 1 or type 2 diabetes? It actually happens in both. Not clearly very different in one versus the other. So both groups of people have the potential to develop neuropathy. Okay, next question. And again, remember to throw in your questions in the chat, and I will try to get to them if we have time. So the next question is, as an individual with diabetes, what are some of the warning signs for neuropathy? Well, the most common warning signs are feeling what's called paresthesias. Paresthesias are sort of that feeling like your foot's asleep, that tingling, pins and needles sometimes described. That can be an early sign of neuropathy. Typically, it's in the feet. So, feeling tingling in your feet that just doesn't go away the way when your foot falls asleep, once you stand up and walk around, that gets better. So, that's an early sign. And that's probably one of the most common burning, feeling that your feet is burning can be another sign. And again, these early signs are things to be able to talk to your healthcare provider, and they can do a very simple test to see if you have significant neuropathy. And you might ask, what's that simple test, Dr. Bob? Well, some of you have probably had this if you have diabetes and seen your provider, and that's to have them uh, take a little wire and put it on your foot. Just sort of press it and bend that wire. Doesn't hurt at all, um, but it tests whether you can feel it, whether you can feel that pressure. And if you can't, you've got some significant neuropathy, and we'll talk about things that you want to do to prevent problems, particularly foot problems. Okay, so that's the early warning signs. It's tingling, burning are the most common ones, and for the gastroparesis issue, um, it can be nausea or early satiety, feeling full early. You're sitting down to a big meal and you eat about a quarter of it, and you thought you were hungry to eat the whole thing, but after a quarter of it, you're already full, and you don't know why. That could be an early sign of gastroparesis. So again, speak to your healthcare provider. Okay. Well, here's an important question. So, one of the things I mentioned about neuropathy, it's tingling, burning, but it can also cause chronic pain. And chronic pain, of course, is very debilitating. So, this next question says, what are the treatment options for patients with chronic pain from neuropathy? Well, there are a lot of treatment options, and so let me walk you through what some of them are. Um, you know, One is improving blood glucose control. That can sometimes improve the neuropathy in and of itself and therefore the pain. Um, One thing to keep in mind, and this is sometimes, um, you know, overlooked or not thought of as a cause for neuropathy for people with type 2 diabetes. There's a particular medication that we use very commonly for type 2 diabetes called metformin or glucophage. Great medicine, really effective. But one of the things it can do is it can decrease the absorption of one of the vitamins that's important for good nerve health, and that's vitamin B12. So if you're having neuropathy, it's a good thing to mention to your doctor, your healthcare provider. Has and you're taking metformin again. Remember, this is for people that are taking metformin. Um, how are my vitamin B12 levels? Because that's an easily correctable thing, and that may get rid of the chronic pain. So let's say you're not on metformin or it's not because of vitamin B12. And again, metformin, great drug, just need to monitor B12 levels. So what are the other treatments for chronic pain? Well, um, there are two drugs that are most commonly used, and I'll give you sort of the generic name and then also what it's typically marketed under. So the first one is something called gabapentin. Gabapentin. Uh, it's also called Neurontin. So that medicine can be helpful for neuropathy pain. And the other drug is pregabalin or Lyrica. Uh, both drugs can be effective treatment. They're treatments that people take chronically, like every day, to manage the pain and symptoms from neuropathy. Another drug that is effective is a drug that is also used for depression, and it's called duloxetine. And that can also be effective for neuropathic pain related to diabetes. The other one I'll mention um, is an interesting one. It's capsaicin. So you may say, I think I've heard that word before. What is capsaicin? Capsaicin is what makes a part of what makes hot chilies hot. It's the chemical that is responsible for the hotness. So, interesting little sidebar is so the Nobel Prize this year in physiology and medicine was given to people that scientists that understood how capsaicin works. And capsaicin is an irritant of the nerves. And there are particularly nerves that recognize capsaicin. So, why am I telling you all about capsaicin? So, there are capsaicin creams that you can use that treat the chronic pain from neuropathy. They confuse the nerves in a sense so that you don't feel the pain. That's maybe the easiest way to explain it. So, another effective potential treatment for chronic pain from neuropathy. And then the last one I will mention is a nutritional supplement that has actually been well studied in clinical trials, and that's alpha lipoic acid. Alpha lipoic acid that can also sometimes help people with neuropathy. So, a bunch of potential treatments to talk to your healthcare provider. Next question. Does neuropathy cause amputations? Yes. So that I'm glad you asked because amputations, diabetes is the leading cause of non traumatic amputations in the US. So, huge problem. Amputations are on the rise, they're not going down. Terrible. And there are huge health disparities. Black Americans are three times more likely to get amputated than whites. So big problem. Diabetes is a big cause, and yes, neuropathy is part of the problem. So how does neuropathy lead to amputations? Well, bear with me. I'm going to tell you a little story of how that happens. So, neuropathy, essentially what's happening in neuropathy when there's that tingling and burning of the feet is that people are losing sensation. They're losing the ability to feel things in their feet because the nerves are damaged. They're not working. Um, and as they lose sensation, they often get to the point where they have no sensation. They don't feel anything in their feet. And that can be a real problem because we depend on feeling things in our feet to know if something is a problem. So here's a simple example. You're walking and you have a little pebble in your shoe. Well, you're going to feel that and you're going to take that pebble out and resolve the problem. Well, people with neuropathy, they many times can get to the point where they don't feel anything and they don't feel, for example, that pebble. That pebble sits there and it continues to irritate the foot until it can actually form an ulcer. Uh, and once the ulcer forms, you're likely to get infection. And when the infection goes to the bone, that's one of the causes for amputation. So, how can people with diabetes avoid limb amputations? Is the next question. Well, if you have neuropathy, and honestly, it's not a bad thing to do otherwise, is check your feet. Catch things early because, you know, a small lesion can be treated and prevent the infection of the bone that leads to amputation. Um, and, I've had some of my patients say, wow, it's a little hard for me to be able to look at the bottom of my feet. I yeah, I can't do that. I don't have that flexibility. That's okay. Uh, a little hand mirror. Use a little hand mirror and use that to look at the bottom of your foot. And for people that have neuropathy, we recommend every day just taking a quick look at your foot, making sure everything's okay. Because again, you may have a cut, a lesion, an ulcer, and not know it. And catching it early is the whole key to preventing amputations and things getting worse. Okay, moving right along. You've got a lot of questions for me today. This is an important topic. So here's the next one. Does chronic pain affect my blood sugar or blood glucose levels? Well, it can. It can. And how does that work? What's going on? And acute pain also can do that. Well, pain causes stress on the body. There is a stress hormone called cortisol that is released with chronic pain in particular. Acute pain can release adrenaline. Uh, both of those hormones can raise blood glucose levels. So it can be a contributing factor. Okay, next question. Is diabetic neuropathy progressive? Does it get worse or can it be reversed? Well, it tends to be progressive, but it can be halted. So with good blood glucose control, you can prevent it from getting worse. What unfortunately we often cannot do is if the nerves have died, it's tough to make them work again. And that is the challenge. That's why, like most things in diabetes, a little bit of prevention, catching things early can prevent things from getting worse. Um, but once they are at a certain point, um, you can stop it from getting worse. And again, the best way to do that is maintaining blood glucose levels in a good range and healthy range. Okay. I'm going to move on and see what kinds of questions we're getting from people. Uh, I have one more question, and I'm going to finish up with this one. So, as you know, we've now talked about neuropathy, what it is, uh, how blood glucose high levels cause it over time, what are some of the treatments for it, all of that good stuff. Um, and here's the question. Are there any self-care routines that you'd recommend for someone with diabetic neuropathy? Well, I already gave you one, and that's checking your feet. If you've got neuropathy, check your feet because your feet can really make a difference. Uh, Being able to catch lesions early, calluses, uh, you know, small ulcers, breaks in the skin, all of that, catching that early and letting your healthcare provider know. The other thing I would say is when neuropathy is significant and you're losing sensation, you should probably not be trimming your own nails because you're unlike we use our sense of feeling to some degree in trimming our nails, and you're likely to injure yourself and not know it. So this is where seeing a podiatrist, expanding your team, seeing a podiatrist regularly, uh, to be able to have good foot care. Let them help take care of your feet once you've developed neuropathy. The other thing for people who have more significant neuropathy and really losing sensation is, their gait, their walking, their balance can be affected. And so you want to think about preventing falls. And that's something you should talk to your healthcare provider about because that really can be problematic. Oh, I see. I got some other questions here, and so let me get to that. Um, so here's the last question I'll say is, um, does neuropathy cause weight gain? Not really, not to my knowledge. I think those are separate. So having neuropathy doesn't necessarily lead to weight gain. So thank you all for asking all of these great questions. I appreciate the opportunity to answer them. This is Ask Dr. Bob. And I'll put a plug in for next month. Next month is American Diabetes Month. So the whole country will be focused on diabetes. At the American Diabetes Association, as you might have guessed, we have a ton of stuff that we'll be doing. So stay tuned to all sorts of exciting events. And of course, I'll be back with Ask Dr. Bob next month. So keep sending in questions. Thank you for joining us. Tell your friends, spread the word, and be well. Take care, everyone.